Hi.
All right, we're live now.
Yay, hi everyone.
Hi, thanks for joining.
Hi.
Hello from every corner of the world. Hi.
Chris is giving
All right,
us
we're live now.
Hi.
Yay, hi
All right,
everyone.
we're live now.
Hi,
Yay,
thanks for
hi
joining.
everyone.
Hi, thanks
What
for
was
joining.
Every corner of the world.
Hi.
Hello from every corner of the world. Hi.
Chris is
All
giving
right,
us
we're live now.
Hi.
Yay,
Chris.
hi
All right, we're
everyone.
live now. Shit.
Hi.
Yay, hi
All right, we're
everyone.
live now.
Hi, thanks for joining.
Every corner of the world.
Hi.
Every corner of the world. Hi.
Chris is
All right,
giving us
we're live now.
Hi.
Yay, hi everyone.
Hi.
Yay, hi everyone.
Is that okay?
This is good now, since everyone has heard us say hi so many times. I'm excited to be here.
Hi, a billion times.
And hi forever.
All right, I think it's like 6 past, so ready to start.
Okay.
So, hi everyone. Thank you all for being here with us today. My name is Natalie Kerres, and I will be moderating today's event on global health. Joining me will be Malvika Bhasin, Wenwen Fan, and Chris Motz. And we are all recent graduates of the MA and MSc program Global Innovation Design at the Royal College of Art and Imperial College, London. Ahead of everything, please feel free to post questions in the chat. We are happy to answer them. We're aiming for an interactive session. Today, we will be talking about our final year projects, all of which are in the global health space. Within this large umbrella, these projects range with protective sports equipment to the promotion of seaweed in Western societies. But they all explore how we might design healthier and more sustainable societies for the future. The COVID-19 pandemic has brought the issue of global health to center stage and exposed all the work that still needs to be done. However, hopefully today, we can provide a more optimistic outlook on the future of global health. So without further, I'm excited to introduce the panel for today. Malvika holds a BA in product design from the MIT Institute of Design and is from Mumbai, India. Her project Lighthouse looks at how we might facilitate social support between cancer patients and survivors through conversations, gratitude practices, and playful interactions. Wenwen holds a BA in Industrial Design from Hunan University and is from Guangzhou, China. Her project Seaweed View aims to promote a more convenient, playful, and pleasurable seaweed diet solution as a way of food education in Western societies and help boost global market acceptance for seaweed. Chris holds a BSc from the Wharton School of the University of Pennsylvania and is from Waterloo, Canada. His project Aura explores how we might better connect expats to healthcare services abroad. And finally, again, my name is Natalie Kerres, and my background is in industrial design from the University of Applied Arts in Vienna, as well as a jewelry design and manufacturing degree. My project Scaled aims to investigate the potential of a controlled motion limiting structure to prevent hyperextension joint injuries. Well, Wenwen is going to start off by speaking to us about Seaweed U. We will have all a short introduction to our projects and then continue with questions. Feel free to post questions in the chat anytime, and let's go.
Thank you, Natalie, for the introduction. Hi, my name is Wenwen. I'm from China, and my project is about seaweed. So hopefully you could enjoy the video. So let's start with the video.
I think of seaweed like not really as a food in and of itself.
It's kind of a weird texture. It's a very different texture to other vegetables.
Some scientists estimate that a network of seaweed farms spanning just 9% of our world's oceans could offset current carbon emissions entirely.
That's awesome.
Okay, so my project is called Seaweed U, and tagline is "Seaweed is the new cool." So it actually starts from my observation from different opinions on seaweed in Asian country and Western country. So I have a question. What if we could create a nutritional seaweed skin similar to nori sheets and apple skins in a way that partly work as packaging, but would add to the nutritional value of the food? That's why I created this nutritional edible packaging. This project is in collaboration with Jacob, a culinary education designer from Imperial College London Chemical Department. The initial experiment was done in Chemical Kitchen, which is a food lab in Imperial College. We have explored different recipes using agar, which is an extract from red seaweed, and glycerin and water. So after a 24-hour dehydration, the compound would form into a film material. As you can see in the first image, it's the very first prototype of edible packaging. And then in the following experiment, please go to the next page. Chris. And in the following experiments, we have to explore using vegetable extras like ginger, carrots, and spirulina, which is a microalgae especially high in protein, to enrich the nutritional profiles and flavors of the skins. As you can see in the left image, we've got different flavors and we've got different micronutrients embedded into these skins. So we also did a further test on the material properties, which shows waterproof characters during room temperature, and it's able to dissolve again in hot water. And as you can see in the second image, you could see it's a pinky and elastic thing, which could be a proper wrapper for different food ingredients. So please go to the next slide. This is the final outcome. These low-cal vegetable wrappers are made from seaweed and vegetable extras. It makes themselves a good source of soluble fiber to be incorporated into daily diet. So people could purchase these wrappers online and customize for different flavors and nutritions for a more personalized product combination on Seaweed U online website. There will be a website in the end, so please feel free to check it out. And I would like to talk about my second project, which is called The Unmentioned. Please go to the next page. This is to discover the unmentioned details of Alzheimer's disease. The reason why I started this project is because I've got my friends' parents and his grandpa was diagnosed with Alzheimer's. So this is an irreversible disease. And that's why I started to look at how can we help people empathize with people with brain diseases and help improve the social environment for these elderly people. And go to the next page, please. So in the next page, we are going to see this, Chris. So in the next page, we are going to see this entrance for the AR simulation. So this page, we can see an old man exploring with an iPad. And because this AR simulation is triggered by you physically walking into the AR portal, and it will greet you with some overwhelming background noises, and you will have lots of questions as you walk around and feel really anxious during the experience. But this is this is what I designed to help you experience the anxiety and everything that feels so weird, because people with Alzheimer, they have to endure this depth perception failure, or they have to deal with the rocks on the carpet, because they know they have different problem in perception failure. So please go to the next page. The next page would describe the interaction with characters, like patient's wife yelling confusing instructions and cats crying like a baby. And I think this project is really important to me because I could physically build an AR experience for empathy. It is going to be an empathy tool for caregivers and also for the family members. It would help them to be more confident in communicating with their loved ones, and also help the organizations to better provide this education for caregivers and get their feedback to refine this prototype. So hopefully we could have more people and have this empathy for the elderly as we are going to enter aging society. So I think this project is just a starting point of using technology to improve our healthcare and the global health system. Thank you.
Thank you so much, Wenwen, for walking us through both your projects, which very different but fall under healthcare. I'll start with my project, which is called Lighthouse, and let's begin with watching the movie.
My life would be like after my operation.
Kind of gift to rethink what is important in life, really.
In later times, there was times when I thought it'd be easier to die.
We live a life of dreamers, but in a heartbeat, all that can change. In 2018, 17 million new cases of cancer were recorded worldwide. By 2030, that is expected to rise to approximately 26 million. With improvement in early detection and treatment, the number of cancer survivors is increasing steadily.
To be able to speak to somebody who's been through the same experience as you.
You really don't have a clue what you're facing.
To meet with someone who already went through and won that battle.
Humans thrive in connection. Patients find hope in survivors, and survivors find belonging in contributing with their stories. But many never get to experience this connection. With Lighthouse, you can. Lighthouse brings the community together in a way that's never been done before. Connect with those who know what the journey is like. Control the content you consume and build shared habits of gratitude. Express your distress discreetly and support those in distress. We combine social engagement with design for wellness to create an interactive digital support group. Lighthouse, a safe place where healing begins.
Thank you. So I knew I wanted to work on mental health, and I used cancer patients and survivors as the use case to get into that space. So the methodology that I followed looked more like a triple diamond methodology, which began with a really broad question of what is the journey of cancer treatment like? Um, and at every stage, diverging became easier because I knew I wanted to work on the emotional aspects. And also, looking at post treatment became significant because a lot of hospitals started working on how to keep in touch and how to keep track of patients post treatment. So, introducing cancer survivors became significant. And what I realized then was that even though everyone's journey and story was very different, people often spoke about connecting with other people who experienced something similar as them, which then led me to creating Lighthouse, which is an app that connects people affected by cancer globally. And the way that this is done is that amongst many features, the main ones are basically a group chat filter, which allows people to control the content that they consume because emotions go really up and down throughout the process. So, giving people the autonomy over what they're consuming becomes very important during such a vulnerable time. Another one is practicing gratitude and writing down what you're grateful for every day, which is proven to facilitate post traumatic growth in cancer survivors and also linked to happiness. Expressing yourself discreetly is significant because people find it relevant to express themselves, but don't wish to do that in a group chat, which is very exposing and might have 500 people listening to what they're saying. So, to be able to express yourself anonymously is very important and has a cathartic effect. One of the main features of the app is to have facilitate intimate interaction through connecting with people that you're looking for exactly. So this works similar to a date. You can write down your criterias and find someone all over the world according to what you've put down. And finally, the last feature, which is a fun factor in building friendships. A lot of people spoke about how they just wish to make friends with people who understand what it's like. And currently, there is no facility that provides that. And in order to do this, I've created the fun feature, which basically works as catching shooting stars. And each shooting star is a question. You can view the answers that other people have given to that question, and you can put in your answer as well. And this basically is that icebreaker, which allows people to have conversations that are beyond cancer. Because cancer is just one aspect to their life and one facet, while there are many different aspects. So to be able to connect in that means. And this is what Lighthouse is about. I would love to take questions.
That's awesome. So I'm going to go next. So again, I'm just going to start by showing my video for my project, which is called Aura.
The world is more connected than ever before. You can chat with people on the other side of the world and fly to meet them in person the next day. We live nomadic lives, no longer bound by borders. But what happens when something goes wrong when you're abroad? Finding healthcare services in a new country is a difficult task. Where do you go? How much will it cost? And will you actually get the care you need? Introducing Aura. Aura is a digital tool that directs you to healthcare services abroad. Find all the information you need to feel comfortable using healthcare services anywhere in the world. Aura understands your medical needs and connects you with a service that meets your expectations and preferences. Simply say what you need, and Aura will ensure that you get the best care possible. Additionally, you can track all your medical information directly in the app. Keep a comprehensive log of your cases and share your records with the care providers you choose in any country. It's time that healthcare caught up to the lives of modern global citizens. Aura, healthcare for a connected world.
So as you can see, my project has to do with how we can make it easier for expats and other foreigners to find healthcare services abroad. And for those of you who don't know, a large part of GID is that we spend 2 terms abroad, and for me that was in Singapore and in Tokyo. And when I was there, I realized that even finding something as simple as a dentist was actually extremely difficult, much less one that spoke English and was able to provide me sort of the services I need. And this got me thinking. And when I was abroad, I talked to other expats and sort of these global nomads who were spending extended periods of time abroad. And I realized this issue was actually a lot more prevalent than I previously thought. And the reason it's so difficult to find healthcare services abroad is sort of these 3 main points. And the first is just that there are insufficient information and resources that enable a foreigner to navigate a new country's healthcare system. To a lot of people, all this stuff seems it's just so foreign to us, and it's very difficult for us to sort of take in all this information and figure out what we need to do with the minimum amount of resources. And the next is cultural barriers. And this isn't just the language barriers and the obvious ones, but it's also just that it's very difficult to adjust to a new country's healthcare practices. For example, you just become very ingrained and used to the sort of care that you've grown up using in your own country. And when you have to navigate these different cultural practices, it can be really challenging. And the last is just very limited interoperability between health systems from different countries. And this means that there isn't much information that's shared from one health system to another, especially across countries. And this means that it can lead to redundant examinations, often conflicting diagnosis if you're getting the same thing treated in multiple countries, and unfortunately, fewer improvements in patient health. So this is where OR comes in, and OR is a digital platform through which you can find all the information you need to navigate a health system abroad and manage your medical information. And again, it does this through 3 key features, as you might have seen in the video. And the first is just providing location-specific information, giving you the essential information you need to navigate a foreign healthcare system. And within that, this might be information such as location-specific pages, best practices, cost, and emergency numbers for a particular country or city. And the next is the service guidance. So within the app, the idea is you can chat with a medical concierge, and you're able to quickly connect with a healthcare service abroad. And this does this by understanding by not connecting you not just to any healthcare service, but to the right service for you, again, based on the sort of care that you've been used to receiving and your medical preferences. And the last is case management. And through the app, you can keep a comprehensive log of all your current and ongoing health cases. And for any case, you can view the treatment you've received and its progression across multiple countries. Additionally, you can share this medical information with a care provider abroad to make sure that you're getting the best and most personalized care possible. And just to end off, as we can know, the topic of travel and health is obviously more relevant than ever with the COVID-19 pandemic. But sort of as I was going through this project, I think it really just cemented a lot of the things that I'd been researching. And I realized this when international travel does resume, services like this are going to be even more relevant. Is it's going to be even a bigger need to sort of understand a foreign healthcare service, and people are going to be more health conscious in general. So that's my project. Again, my name is Chris, and this project's OR. I'm going to hand it off to Natalie, who's going to talk about her project.
Natalie, your mic is muted.
Sorry. Thank you, Chris. Thanks, Malvika. I'm heading off with the project Scaled and start with the video as well. Enjoy the next minute.
Today, we're increasingly making fitness a priority in our lives. But accidents can happen anytime, anywhere, in the blink of an eye, causing long-term effects to mobility, especially due to the constant exposure to stress, shock, and strain. But could we protect ourselves from accidents or even prevent them from happening in the first place, all without hindering mobility? The innovative structure of Scaled automatically activates protection, providing shock absorption and friction resistance that even prevents hyperextension. Scaled mimics nature, modeled according to your situation of activity? Could injury prevention be as simple as... Today, we're increasingly making fitness a priority.
Sorry about that.
But accidents can happen anytime, anywhere, in the blink of an eye, causing long-term effects to mobility, especially due to the constant exposure to stress, shock, and strain. But could we protect ourselves from accidents, or even prevent them from happening in the first place, all without hindering mobility? The innovative structure of scale automatically activates protection, providing shock absorption and friction resistance that even prevents hyperextension. Scaled mimics nature, modeled according to your situation of activity. Could injury prevention be as simple as nature's evolution process? In analyzing a range of animal scales, geometric variations were identified. A scale shape is defined according to an animal's requirements, such as mobility, predatory dangers, and environmental challenges. Imitating this model, we look at your needs, taking into account age, fitness level, and type of activity. Scale uses the innovative technology of parametric design and biomimicry to meet your exact requirements, enabling the future of sensory injury prediction and delivering a customized, lightweight solution that prevents injuries right from the start. Scaled injury prevention for an active future.
Yeah, thanks for watching twice. Yeah, so my project Scaled is basically a parametric algorithm to produce flexible and custom-fit protective wearables by applying nature-inspired interlocking scales for precise motion control according to a wearer's needs. This project started with a core vision. How might we design for life quality to keep up with the global rising longevity? How could we avoid long-term immobility by preventing injuries in the first place, to empower a society for healthy aging? By analyzing why and how injuries happen, opportunities of intervention were identified. Research showed how nature is protecting itself from survival. As you can see in this picture, nature does it with skin, shells, and scales. So by analyzing a variety of animal scales, geometric changes were identified. Therefore, a scale shape is designed according to an animal's needs as predators, environmental challenges, and mobility. Scale was developed by mimicking nature's evolutionary approach of protection and the method of research by design practice. With a lot of failed prototypes and many iterations, the design process was a key element to generate the controlled motion limitation structure. As well as many testings and materials, user testing and failed prototypes, this led to the final working prototype and therefore a working data-driven algorithm to produce the mass customized protective and supportive wearables. Scaled now goes through user testing and initial force tests and is going to be further developed for serious production. To start with the general question of us all about inspiration, I'm gonna talk about that right now as well. So personally, my mom lately suffered from a serious wrist fracture due to a casual fall. And after time and cost-intense surgery, treatment and rehabilitation, she still has not gained back full mobility, strength, and is therefore limited in her daily life. So how can design prevent injuries in the first place and help improve the quality of life to ultimately keep pace with longevity? Research shows that human joint injuries are often recurrent and likely to cause long-term immobility. Many solutions can be actually found in nature, as animals are physically protect themselves from threats. And so I'm trying to help with scales for an active future of our society. And opening now the questions for the whole group on what inspired your projects.
Yeah, I'm happy to start. Thanks, Natalie. Again, that's awesome. Yeah, so as I sort of mentioned in this project, I guess a part of GID is you spend so much time abroad, and you're sort of exposed to to not just the problem with sort of disease average travelers have. There's people go for like 1 or 2 week trips have, but also the ones that people who spend extended periods of time abroad feature. So when you really have to integrate into a system as a whole as a foreigner. And for me, it started as something simple as just trying to find a dentist, but they really snowballed into this larger thing of, wow, there's this big sort of information gap between healthcare systems in a particular country, and for anyone who's trying to access that not from that country.
I can go next after Chris. So my inspiration actually began with the fact that I have a personal experience in cancer myself. I was diagnosed with cancer when I was 10 years old. And all that I understood from it was that there is a journey of cancer treatment a lot beyond just the physical aspect. And there is a sort of emotional aspect to it during treatment and even post-treatment. And in order to confirm this, I did a lot of research with hospitals in Singapore, in India, and in London. And I realized that people do feel it more. The more I spoke with patients and survivors, the more it confirmed the fact that there are so many different aspects to cancer beyond the physical aspect, which are extremely significant to be catered to. And that is why I started Lighthouse.
That's super inspirational. Thank you for sharing. That brings us to the next question already. As we all are aware of the current COVID pandemic, the question is now, how did COVID-19 pandemic shape your outlook on your projects? Like, question to all of you.
I can start again. So again, obviously, I think my project sort of falls in these 2 buckets that are most affected by COVID. The one being travel, and the other just be sort of general global health. And for me, it didn't necessarily alter sort of the course of my project. I think if anything, it just sort of confirmed a lot of the. It sort of just exaggerated a lot of the problems that I previously identified. And even when I was doing research and so testing it and talking to people, a lot of these issues became even more to light. Like, say if I'm abroad, like if I'm in Japan right now and I have to go through, the same sort of procedures of, I have to get tested for COVID, have to see what are the different health regulations for COVID in a particular country. Again, you still run these big issues that there's just very little information specifically for foreigners. So if anything, it almost exaggerates the problems that are already there. And again, I think going forward, I think we're probably going to move into a society that's much more health conscious in the future, and especially when it comes to travel.
Thank you. Yeah, sharing my experience as well. Of course, with the prototyping a physical project was tough, was not easy, stuck at home, but doing my best, literally. And of course, it shaped our all project outlook extremely. We had to shift plans, but here we are, graduated recently and all finished our projects. I will start with the first question from our audience, which goes to Wenwen. Okay. Do you think plant-based diets will become more prevalent in the future? And why would you think seaweed could be a popular food in the future? Super exciting.
Okay, thank you for the question. So I think everyone already identified the vegan trend right now. It's like everywhere. So according to United Nations, there will be 9.7 billion people inhabited planet Earth by 2050, which means we are going to run out of resources very, very soon. And we only have 60 years of harvest left. That's why I kind of had to look into ocean to find this green gold seaweed, because it frees up the land spaces and it's a vegan superfood providing lots of important micronutrients. So if anyone in the audience have not yet tried seaweed, I really encourage you to do that because you're going to fall in love with it. It's got full bunch of ingredients in micronutrients, so such as iodine, iron, and omega-3 fatty acids. So you name it, just give it an example. And seaweed can grow 30 to 60 times faster than land-based plants, which means it's an underwater carbon sink. It could potentially offset our current emissions, which will be more than 50 gigatons a year. So giving this huge much of benefits, I don't think anyone would not wanted to try and have to join us in this seaweed trend in the future. So I really encourage everyone to just start with a little bit of seaweed, maybe the seaweed crisp.
That sounds amazing and yummy.
Wenwen, I'm sorry I said I didn't consider seaweed a food in itself in your video, but I'll have you know I do snack on it all the time now. Have you heard of Beyond Meat?
The Impossible Burger.
Impossible Burgers, yeah.
Yeah.
What do you think of those? And do you think those would be more? Do you think they'll become more prevalent in fast food restaurants?
I think obviously there will be more interest in impossible burgers, impossible something. So, but I don't think it would substitute everything, because still we could not blame everyone for being a meat lovers, but could just there would be more lab-grown meat and lab-grown.
Oh no, I think we lost her.
Did we lose Wenwen?
Oh, I'm sorry. But that was super interesting. I'm definitely going to try seaweed.
Do you want to take? I think we all should.
Let's get the next question forward.
From Jess?
Yeah. Thanks, Jess, for commenting. To everyone else, just feel free to ask questions in between. So Jess is asking, your projects all have a holistic approach to developing healthcare innovation. Can you explain a bit more how and why you incorporated a holistic emotional perspective into your work? Wow, great question. Thank you so much. Who wants to go first?
I can take that. For my project, I think the way for me to emotionally connect the most was to just reach out to people, go out there. The hospital visits made a huge difference because I was in that space. I could see everything happening in front of my eyes. So about interviews is you hear what people are saying, but when you're visiting the hospitals, you can view through observation. And to be able to connect with all the stakeholders involved, so not just the doctors, the clinicians, but also the social workers and also the therapists and also the nurses and the technicians and the patients and their families, made it a lot easier to develop that sort of empathy and understand all the different aspects of people's concerns, which differed majorly from different countries to different countries, and different societies and cultural factors played a huge role. The economic state and the literacy rate of the country played a huge role. So it was mainly going and seeking out and talking to anyone possible, because that made a huge difference in understanding and categorizing information and making sense of everything that's happening.
I can sort of agree with that. I think we all run into it, especially when it comes to health. It's just inherently a very emotional and personal topic to everyone, and you can't really you can't avoid that when you're talking to people and doing research. Specifically for me, sort of, because I was spending a lot of my time in co-working centers where you run into a lot of expats from all over the world, and they even if they're not going to the doctor a lot, they generally harbor very strong and sort of personal views on healthcare, and that just sort of affects the way they perceive healthcare system anywhere outside of their own country, because the practices that they've grown up with have just become so ingrained.
Yeah, I think it's really great on speaking in general of design. User-centered design is just about going out there, talk to your users, get into space, and figure out what we really need and which exact problem we need to solve. Thanks. That were great answers. Should I head to the next question, or do we have?
Malvika, you have another one.
Okay.
That's to Malvika. Health problems are really sensitive and hard to access to patients and information for privacy issues. How did you get into the community and involve them in your project? Great question. Thank you so much.
Thank you so much, Karen. This is an interesting question and much needed. I got lucky because I'm a cancer survivor myself. So getting into all the Facebook groups, which were cancer patients, survivors, and supporters, became easier. I built a lot of trust by just posting on the group myself, being very active, commenting on people's stories, writing down my story. It just built that level of empathy that I know what's happening because I've been there and I would love to talk to you. And it kind of broke that ice and that barrier between just regular research with people and understanding what their journey is like firsthand. And also, I'm not totally sure, but I do think that it helped when I reached out to hospitals because I mentioned I'm doing global innovation design from RCA and Imperial, and I'm a cancer survivor myself and would like to research on this, which made people a lot more responsive. So I just think I got lucky there.
Yeah, I would also like to add on to my personal experience. When I was doing my second project in doing Alzheimer's design, I reached out to a lot of Alzheimer's communities, and to my surprise, they are very kind to let people into their personal community because they feel like they've been omitted and they've been like the smaller group in the society. So they are actually welcoming people from different places, especially from design students, to have this perspective of their real life and then decide for something better. So I would actually encourage whoever is designing for like healthcare or designing for like these elderly products, go out and go into their life.
Yeah, I would like to add to that actually. There were a lot of people I connected with weren't comfortable talking to me or interviewing with me and connecting with me, but there was a huge bunch of people who actually wanted to make a difference to other people's lives, and survivors and patients who thought that this is going to make a difference and would love to be a part of it. So it's just about finding the right people.
Mm-hmm.
Amazing insights. Thank you so much. I think we already have a next question from our audience. Chris, you want to take that one?
Sure.
How does using Aura differ from using Google and finding medical experts and practices in other countries? Great question.
Sure. So that's a great question. So I think the problem that I thought when I was like, say, for my example, finding a dentist in Tokyo is there's almost too much information and too little information at the same time when you use Google. Because if you could Google Tokyo and dentist and you get 1 billion results, you'd get like, the 100 closest dentist within like a certain kilometer radius of you. But from that, you still don't really have that much information about whether or not the appropriate dentist for you. Even if you're reading reviews, there's a good chance that it's going to be specifically by by Japanese clientele who've dealt with them and I'll just use that sort of style of dentists. So their reviews are sort of just from their perspective, but they could be very different for you. You still can't really figure out, do they speak English? Do they accept my insurance? What are the practices? How do I book it? Do I call? A lot of information isn't available immediately from Google. So the point of Aura is that it connects people, connected to a service specifically based on what's most appropriate from you, from the care that you've received in the past. Like if I'm from Canada, it would connect me to a dentist that maybe, connect me to a dentist, they would give me sort of a Canadian style of care or something at least more in line with what I'm used to and give me feedback and sort of information from other people who've been in similar positions to me.
Yeah, if I want to if I'm able to share my experience in Tokyo. I had a bad eye infection. I was like, Google the next eye doctor, and just went to the closest one. And unfortunately, no one spoke English there. So because I wouldn't have my own translator with me, they wouldn't let me in. They'd be like, sorry, can't help you. And like literally, how do I find out on Google who would take me with my insurance, with someone speaking English there? It was a tough time. So just to add on that experience. I guess we have one question to Chris and Malvika especially coming up on. We know that a lot of research we all did was taken in a variety of places, as our program sent us to Tokyo, New York, Beijing, and Singapore, and especially London as well. And Malvika conducted a lot of research in Singapore, India, and London. Chris did similarly conducted it in Singapore and Tokyo, if I'm right. And the question is, what was the most interesting insight from your research around the world? Where are the benefits to like get hands-on the culture?
I can start with that. It was really interesting to see the difference between how a developed country and a developing country handles the treatment of cancer, and the fact that how the importance of the economic condition of the country and the literacy rate of the country. So a lot of what I experienced in India was to do with how there isn't enough social support from family when they're going to the hospital, when they're leaving their villages and going to a city and getting cancer treatment in the hospital, because they feel like either the patient, which is an adult, or the child is going to die anyway because cancer is not curable. So there is this sort of myth that cancer is not a curable disease, which is what prevents people from being supportive. And this is something that I couldn't imagine existing in other parts of the world at all, but it does exist in India. In Singapore, on the other hand, because it's such a small country, a doctor has at least 2 to 3 days to prepare before breaking a cancer diagnosis news, which does in the other countries that I visited. So there is a lot of difference in terms of how the country is placed, the systems within it. Even mental health within cancer space makes a huge difference in terms of how the healthcare system works in that country. But despite all of these very different things, what a person goes through individually during chemo or because of hair fall and how it affects self-perception and self-identity is pretty much the same everywhere, and that kind of goes beyond boundaries. So it was good to identify with the factors of differences and the factors of similarities between all these places.
Amazing, thank you.
Yeah, and I can sort of add on to that a little bit. But again, sort of what I've been saying before, I was really surprised. Like the biggest surprise for me was just sort of how ingrained these cultural expectations of healthcare are, and how strong these beliefs can really hold true. Like, for example, I could, like, if I'm from France and I go to a doctor in Hong Kong, even if they're a pretty good doctor, I just might not perceive their care is particularly good just because it's different to the care that I've been used to receiving. And again, this be something is like minuscule, is say even like the verb tense is something that some doctors use. For example, someone might say, "Oh, you should do this," or like, "You could do this if you want to." And even these little differences are like really important because they might perceive the doctor as being hesitant and not really knowing what they're doing if they speak like that. And I think it's best summed up with a doctor, with a woman I talked to in Singapore. She's from the UK, and she said that she'd sooner fly home than visit any doctor in Singapore, which just shows you that how strong these beliefs can be.
Yeah, that's so true. I know have a lot of friends actually who would fly home for dentist visits just because they don't trust anyone else. We have another question. Time is flying from the audience.
Yeah.
Should we? I think it's a good one to find an end as well. Chris,
yeah. Also, just as Before we end, if you have any other questions that we didn't answer, feel free to email us directly, and we'll happily answer any of them and get back to you.
So, Chris, can you pull up the last question?
Sure.
From
the last one?
Yeah.
Yeah.
That's not quite related to the project, as mentioned, but an interesting one, I think, motivation-based and inspiration. So what was the motivation and the reason to choose and take forward global innovation design at Royal College of Art and Imperial College?
I can start with that. It was mainly because global innovation design seemed very impact-driven, and the fact that cultural understanding makes a huge difference when you start designing, because cultural differences make you understand audiences better. And there was no other program in the world that provided exactly the perfect combination for both of these things to grow as not only an individual, but as a designer as well. And that's why I selected the program.
Totally agree. I think for me, global innovation design gives me opportunity to be an insider, not just a traveler. So you basically live in different cities and to look from the inside culture perspective and also make local friends. That's like quite influential when you're doing global design, because nowadays we've been connecting through like face-to-face interaction, but also like this online discussion. So I think going into local societies would give you another perspective for like just, yeah, I just think it's so cool, like just a simplicity, cool thing.
Yeah, that's I think that, you know, for me, one of the things sort of that initially sort of like made me want to apply, for example, was just sort of the unique combination of design and the technical aspect to it. You know, being at the RCA and being the Imperial, that's what like seemed really interesting. But what kind of pushed me over the edge to begin this program was actually talking to some of the alumni and seeing some of the projects that they had produced, as hopefully these have done the same, and seeing sort of like the interesting things that they had done and like the things they were choosing to go do afterwards and like where they were in their lives was like really, really interesting to me, because they were just sort of doing these, where they developed like this really interesting and meaningful projects based on their time in GAD. And again, sort of to echo what like Malvika and Wenwen said, I think you said this, like you really get to like ingrain yourself in a different culture, but it's like kind of this unique balance of like, as soon as you get comfortable in one place, you have to like leave, which is the flip side of that. You know, you spend 4 months getting used to living in Tokyo. Then as soon as you're used to it, you have to leave and do it all over again. But that's sort of what makes it fun.
That's really emotional, looking back to that. Yeah. To add on that one, for me, was really learning about cultures. Like, what does culture really mean? Living in different cultures, that just pushes you out there. And as well, I think the big moment I had was realizing that these global issues we talk about every day, sustainability, healthcare, society, whatever it is, and there's no global solution. There will never be a global solution. We have to figure out the roots of the problem, look into it deeply by society to society, by people to people, and then figure out a solution for them and not a solution for everyone. And I think that's as well for us now today, having the global health talk, seeing that we all do our little impact bit from different roots, but altogether we will some sort solve the big umbrella of global health. To finish this wonderful conversation, the last question we had would be what our next steps would be to continue with this project. And as well, now we're happy to hear from any one of you out there. Feel free to reach out. You have our contact details to get more information, ask for collaborations, finishing up with where everyone is heading to.
So I can start. So in terms of where I'm heading to, I'm not moving during quarantine. I'm not really. I'm in Waterloo, Ontario right now, and I'm not really planning to go. Unfortunately, not planning on leaving here anytime soon, just because of the quarantine. But I guess lead to the next step. It still is taking this forward and continuing to develop it and taking those sort of like these prototypes and turning them into an MVP. And then, you know, when the climate's right with travel and everything, like actually testing it in a real environment.
Yeah. My case is very similar to Chris's, where I will be working on Lighthouse again. There are certain aspects of it that I need to figure out in terms of how is it going to generate revenue, or will it at all? Otherwise, how can I develop this as my next step and create an MVP and test that out with users to see how it works? Do people prefer it over Facebook groups, or are they more comfortable with Facebook? Or how can I create something that's a complete differentiator? So that is something I still need to work on, and I'm looking forward to do that.
Yeah, for me, the first the food project would be more on customization and also for collaboration with the chef, because I think in the future, like customization and personalized diet would be the trend, and we could already see the emerging trend for like DIY something. So I think for me, we'll be going for a test run or test selling in farmers market. So you might see me in one of them farmers market in the future. And feel free to drop me a message if you're interested. Thank you.
Amazing. Yeah, for me, already taking my project further and looking on optimizing the algorithm, user testing, force tests to actually get this thing out to help people as soon as possible. This was it. We are over an hour now. Thank you everyone for joining today, for great questions, and for having a good time. Thank you so much.
All right.
Thank you very much. Bye.